Hello everybody, welcome to the County Seat. I'm your host Chad Booth. Today is one show that might be one of the most important county seats you've watched. We are talking about the arrival and imminent distribution of the COVID-19 vaccine. And there are a lot of questions about it, and they all center around about how you get this distributed when it arrives in the state at our borders to each and every corner of the state. We'll be talking about the priorities and the logistics and all sorts of things, but it's all built on the backbone of one group of organizations, our local health departments. So that's where we will begin our discussion today.
Utah, like other states, has both statewide and local health departments. Utah's Department of Health is made up of 3 divisions, and they oversee some 50 programs, ranging from disease prevention and control to anti-smoking campaigns. The state is called upon to protect from the effects of man-made and natural disasters, and they also provide healthcare services for Utah's most vulnerable populations. But the State Department is just one piece of Utah's health system. 13 regional health departments cover communities across the state at the local level. Some health departments cover an entire county, while others cover multiple counties.
If you're in an area that has a rural population and small counties that are maybe lean on funding or don't have the resources to staff a full health department, it's wise to combine forces and be under a district health department. Our Board of Health consists of a county commissioner from each of those counties and an appointed citizen, and we work hand in hand with the Utah Department of Health. As far as our whole health department, we have about between 50 to 60 full-time staff at any given time to serve the 5-county area in southwestern Utah. Even though we're kind of lean on staff, we work very closely with community coalitions and community partners, and that's how we magnify our efforts and serve the community.
Local health departments record births and deaths, handle licensing of child care centers, and enforce food and safety and cleanliness standards in Utah's restaurants. With the arrival of the COVID-19 vaccine, local health departments will be instrumental in administering vaccinations and ensuring that the new vaccine is distributed equitably statewide, which is something else health departments have been preparing for in the event of an emergency.
Local public health has been involved in emergency preparedness and response ever since the anthrax attacks following 9/11 years ago. It was decided on a federal level that funding could be given to public health on the local level to be able to respond to bioterrorism or a pandemic or any type of large-scale emergency that affected the health of the public. And so we were already running annual flu shootout drills where just with the vaccine that came out every year for the annual flu shot, we would do mass vaccination exercises that would be a drive-through model where people could get vaccinated without leaving their cars, large walk-through models, and so we would practice every year with the normal flu vaccine. We've already got the way set up to do mass vaccination and offer that to as many people as possible in a short amount of time in our 5-county area.
For the county seat, I'm Derek Dowsett.
Well, now you know how the pieces are put together. We're going to talk about how the parts of the puzzle flow through the system. We'll begin that conversation with our panel of experts when we come back on the county seat. Welcome back to the county seat. We are talking today remotely about a topic that is related to why we are all talking remotely. We're talking about the plans and preparations for the distribution of a COVID-19 vaccine. Joining us for the conversation on how all these logistical pieces are going to come together, from Tooele County, we have Jeff Coombs, who is a public health officer out there, and from the state, Rich Lakin, who is the guy that's in charge of all the immunizations at the Utah State Department of Health. Guys, thanks for joining us today. So is this an important conversation to be having right now?
Yeah, absolutely. We're so thrilled and excited that we're finally here. That is, we keep hearing that term, light at the end of the tunnel, but it's nice just to even start to see that light. We know we have a ways to go and we need to continue doing what we've been doing. We're right in the midst of this pandemic still, and there's a lot of COVID going around and our hospitals are still full. But we couldn't get this at a better time. Couldn't ask for a better Christmas present than to have these vaccines that have been approved or about to be approved. And we're tickled, and I know a lot of people are relieved and really looking forward to what's coming ahead.
You know, I've looked at this whole thing kind of through the eyes of, and I've been told several times, this is the biggest deal since the polio vaccination. back in the 60s. And any of us who lived through that, and all the sugar cubes and all the other little things that we did, it was just kind of an event that happened. And it was everywhere. It was ubiquitous. It was in every nook and cranny all at once across the country. How is this similar or different to that sort of an effect logistically?
Well, I was born in '66. So, I was too young to really understand it, but I can tell you I have an uncle that was hunched over for a long time. And being young, I had no idea what it was. Found out later that it was polio that he had. And I still remember the comment where he said, "I wish the vaccine would have come out 2 years earlier." So the process that we have now from the 60s to now is that we have really progressed in the way that we can get a vaccine out quicker. Not only can we move it through the clinical trials quicker, because we've got the technology, we are able to look at the data quicker. We're able to pull blood samples, from these samples to ensure there's an immune response. And from a vaccine standpoint, we can order the vaccine online, and we can have it sent to a whole bunch of different places than just particular places where, for example, in for polio, people were just lined up for blocks and blocks and blocks to receive that vaccine. Well, we have the capability now to just order these online and have them sent directly to these facilities so they can start vaccinating. For example, we send them directly to the local health departments and let them do their job and let them start vaccinating their residents in their health district.
So in the process of doing this, you have 13 different health systems in the state as far as county health departments. Not every single one has an individual health department. So it's not like you're trying to run interference to 29, but you are trying to run interference to very different portions of the state. How does the difference in the population bases, the distance from central hub, affect the distribution of a vaccine?
Yeah, so we've got two vaccines. We've got the Pfizer vaccine, which is the ultra cold, and it comes in a minimum doses of 1,000. Well, actually 975, based on the doses that are in the vials. We also got the Moderna vaccine that's coming in at a minimum dose of 100, and it can be put into a regular freezer for storage. And then again, the Pfizer is that ultra cold. So when you think about logistically across the Wasatch Front, the Pfizer vaccine, which can be utilized more quickly amongst these larger health systems and larger health departments, are more likely to get the Pfizer because we know they can use the minimum doses of 1,000 in the time frame of the vaccine. When you're talking about Central and San Juan and all these other areas where logistically the populations are smaller, not only in the hospitals, but also the populations of the public are smaller, and therefore it may be impossible for them to utilize 1,000 doses at once. And we can logistically send smaller doses around the state in those rural and frontier areas so that they can utilize that vaccine. And then the nice thing about it is when they get close to doing, let's say they've done 80 vaccine or 80 doses of the 100, they go into our system, they put in another order, and another 100 is delivered in 2 days.
I did want to talk about how quickly it can get down the pipeline.
So our system is like CDC is a bank, and there's the state of Utah in this bank, and they put all these vaccines in this bank that we can draw from, and we can draw as long as there's vaccine in that bank. So we can take that vaccine in there and we can go into our system and say, all right, looks like they're giving us 30,000 doses this week. And so then what we do is we go into our model, and which is a representation of across the whole state of Utah. And we say, okay, Salt Lake County Health Department gets this many doses based on population. Central gets this many doses based on population, and then Tooele County gets so many doses for this population. And when it's delivered directly to those local health departments, then it's their responsibility then to kind of take that bank of vaccine that they get from us, and it can be given to the local health departments, and then we allow them to draw that down and vaccinate their residents.
And then to build off of what Rich has said, the way we'll do it at the local health departments, the beauty of the 13 local health departments is each one is designed to accommodate the needs of their specific community. For example, the way vaccines will be rolled out for the teachers will look different in Tooele or Central Utah than it will in Utah County or Salt Lake County. But they both work. The way that we plan to roll those out in smaller communities, we'll be going right into the schools because we do that every year. In some jurisdictions, they'll have a closed pod where all the teachers will come to that one closed pod. Some of the districts may contract with other providers to help them vaccinate their schools. So there's a variety of ways that this will be done, but there's a specific plan for each one of the 13 districts of how to work through those waves that we've identified to do first the hospital and healthcare workers. Then we're going to be working on the education, the teachers and staff. Then we'll be working on first responders. And there's a specific plan in each 13 health districts of how we're going to do that. And in the meantime, we will be coordinating together the 13 districts in the state. Rich, what phase are we in, and are we prepared to move into that next phase? We want to try to stay coordinated as much as possible to not have confusion or people crossing jurisdictions trying to get vaccines when they're not maybe at the right time yet. And we'll try to coordinate that as much as we possibly can with the state.
So, Rich, is that a concern of yours that some counties are going to get ahead of the other counties, and you know, they'll be saying, okay, we're all done with the critical healthcare workers, and we've got the nursing homes done, so now we're going to start working on people age 75, and yet the next health system over is still trying to get their critical healthcare workers done. Is there something in the model between the 13 health systems and the state that kind of keeps check on that?
You know, it's going to be really difficult because we know that some, based on the population, will move through some of the priority populations a little bit sooner. And what happened in H1N1 in 2009 is that very case, is that some of them moved ahead. And so then we had people moving that lived in one health department and drove over to the next health department to get the vaccine earlier because they had the vaccine, you know, they were ahead of the schedule. So we're really trying to work with our local health departments. Again, this is a public health effort, and it's not a Utah Department of Health effort. It's not a local health department effort. It's really a public health effort where the 13 local health departments and the state health department come together to ensure that hopefully we can have a unified response across the whole state. But we, you know, understanding that populations do vary within these health districts, and there could be some earlier vaccinations and some delayed in some areas. And, you know, we'll just have to meet that road when it happens.
We're going to take a quick break, pay some bills. We'll be back to continue our conversation about the rollout of the COVID-19 vaccination in just a minute. Welcome back to the county seat. We're talking about the rollout of the COVID-19 vaccine. There are doses in the state already. They're being distributed, and a lot of us are just now becoming aware of it, although we've heard talk about it for a while. But I would like to address the fact that you can't just ship out 1 million doses of a vaccine to a state and then say, okay, well, we got it. Now what are we going to do with it? When did you guys start planning for this?
Well, at the local level and at the state level, you know, we have emergency planning staff, and we've had for years, and a good portion of that has been planning for the possibility of a pandemic. So we've had plans in place, influenza response plans and pandemic response plans. And so that's where we start with this one, is we pull those out and we start to tweak them to the needs of this particular pandemic. And we've done that. So there are plans on how to distribute it to the various levels and individuals. And when will we do a closed pod? In other words, when we have specific populations that come to us, and when do we do an open pod, when we invite populations to come, openly to us. And so we understand those scenarios. And the good thing is we've had experience doing this. We've done it before. We give vaccines every year, and we've had the H1N1 experience where we've done closed pods and open pods. And so I think the plans have been in place and just tweaked, and something we've been planning for a long time.
How do you keep from not overloading the system? You're talking about pods and phases and stuff. When you open it up, are you, either one of you, concerned that it's going to be like the movies where the rush before Christmas happens and they open the store and the clerks get trampled or anything like that?
We actually roll this out in phases to try to eliminate that whole process. Meaning, we start with hospitals. For example, hospitals receive the vaccine. So Intermountain, University of Utah, Stewart, ACA, all these hospital systems receive the vaccine directly from us, so they can take care of their staff. So they're doing that right now, and that eliminates once that could be 60 something thousand of the population. When this is done in December and January, that part of the population is done. Then we got remaining hospital workers. We got long-term care staff and facilities. They're kind of separated out. The long-term care staff and facilities are being taken care of by Walgreens and CVS, meaning they have these teams that go into these facilities. And then we got educators and staff that local health departments and community nursing services will help with. So we kind of spread this out all around to try to eliminate that overload in one particular system or one particular health department.
Excellent. We're going to take another quick break here. When we come back, I want to actually address the issue of what we can expect, because everybody is right now sitting here thinking, when's my turn? When do I get to go? And I think we should address that when we come back. We're talking about the rollout of the vaccines for COVID-19 and how they're spreading out across the state, and we'll be right back in just a minute. Welcome back to the county seat. We're having a conversation today about the rollout of the COVID-19 vaccination, and we've covered the logistics of how it's worked. We've covered how it's kind of tiered, but I know the question that everybody's going is, okay, I'm 47 years old. I have like one underlying health condition. When's my turn? How are you doing this, and what are the basic tiers that people should be anticipating?
For December, we got hospital workers, healthcare workers. That's already rolling out. January, February, I'll give you that's a whole phase. So December through February is a whole phase. And within that whole phase, we have hospital healthcare workers. We got long-term care staff and residents. We've got non-hospital healthcare workers. We've got educators and school staff. And of course, tribal public health and frontline public health workers that will be vaccinated. And then as we move into the February, we've got essential protective services, and that's your police, fire, et cetera, that would be vaccinated. And then we get to the population of those that are over the age of 65 that will start vaccinating, and tribal communities. And then at that point, depending on the amount of vaccine, we'll have to make some adjustments of where priority populations fall after that.
And it's when in that phase when we really need the public to be in tune with their local health departments. We will advertise, which groups we're doing, how we'll be doing them and rolling them out, where their shots will be available. Like Rich said, there may be a variety of locations individuals can go. The 65 and older population will probably do special rollout vaccines just for that population, and have them at the senior centers, have them in drive-by shot clinics and so forth. So we just need the community to be patient, to be aware, and we can't emphasize enough to continue to do those safe practices in the meantime until we do get the shots out.
We are just about out of time. Any last comments for either one of you very quickly, that something that people need to know about this that they don't? Rich, we'll let you go first.
Yeah, I think, a lot of people are concerned about the safety of the vaccine. We know that at least 70% of the population is very interested in receiving the vaccine, so that's great. But the safety of the vaccine, there's been no compromise to ensure that this vaccine is safe and effective. they worry about that it was phased out too fast. But again, there's a number, like pregnant women will not be able to receive the vaccine. Those under the age of 16 will not be able to receive the vaccine of Pfizer. And that's because those haven't been studied. And so it allows us to kind of move those clinical trials at a faster pace because we've got smaller populations.
So as it's been approved and tested for some, others are still in testing or just starting into testing so that they could get it where it was needed most first?
Yeah, so if they don't have the data showing, for example, the Pfizer vaccine was those for 16 and older, and because the clinical trials were not done on those under the age of 16, then that they don't have any data to ensure that it's safe for those populations underneath, so they will not be able to receive the vaccine. And then same with pregnant women. This vaccine was not in clinical trials given to pregnant women, and they don't have the data, so therefore it's classified as not a safe vaccine.
Makes sense. Jeff, last comments for you.
I think we want people to know that there is a plan in place to distribute and get out the vaccines in an efficient and safe manner. I know there's been a lot of anticipation and anxiety about when people will get their shots and how that'll all be done. It'll be done fairly. But I just want to instill some confidence that that's been well reviewed. We have a lot of competent people that have been trained, and it will get out in a safe and efficient manner, and brighter days are ahead.
Excellent. Thank you so much for joining us, gentlemen. Thank you for tuning in. Remember, local government is where your life happens, whether it be paving your street or getting a shot that saves your life. So be engaged, be part of the solution. We'll look for you next week on the county seat. Thank you for watching The County Seat. Be sure to subscribe and turn on your notifications to keep up to date on the program and happenings around Utah.